a plan years in the making.
We have to do something about the Austin State Hospital. It's unsalvageable. We need to rebuild it.
Looking beyond the medical community to improve mental health. After years of talks, the state announced today it is pursuing a once-in-a-generation attempt at changing the way Texas provides mental health care.
UT Dell Medical School will lead a $15.5 million redesign of the Austin State Hospital. Now, it's part of the $300 million Texas lawmakers approved last year that will go to improving psychiatric care in our state. KXAN's Brittany Glass has the story.
A necessary replacement for the current Austin State Hospital.
Well, we have a state-operated hospital that's now over 155 years old. Buildings are in somewhat of disrepair.
But the goal here is much more than a building facelift. This is a redesign project aimed at overhauling a facility with a history of staffing shortages and sexual assault complaints.
Rather than talking about all the trials of serious mental illness, what if we started to think about brain health? What are effective treatments? How is that being informed by neurology, brain imaging?
Experts say this reimagining of our mental health system requires collaboration.
But we need the community engaged and involved to make this successful.
Dr. Steven Strakowski says it goes beyond partnerships between the medical school and local and state mental health authorities. It also involves key players in our legal system, like judges and sheriffs.
One of my goals here is to really get people who've been arrested with mental illness put in the place that fits their level of care they need, not the charge they have.
Getting the law to catch up with modern mental health, he says, is just one way to fix cracks in the system.
And so part of that's going to be working with policy and the laws to make it as adaptive as possible to getting people the best care.
Brittany Glass, KXAN News.
Working with State Senator Kirk Watson, the Dell Medical School has created a steering committee of stakeholder groups that will be part of the redesign process. They include several state and county organizations like the ones listed on your screen, among others. And questions about the future of the Austin State Hospital aren't coming out of nowhere. We told you in 2016 about how lawmakers require departments to look at the feasibility of moving the hospital to a new location. Although there is other development on the property, such as the Central Market location. According to Travis County records, the hospital owns land in between Guadalupe and Lamar from 38th Street to 45th Street. The current value of the land is close to $360 million.
Another law